Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to go over some ways to fall safely with reduced risk of causing injury or harm to your body. Now, of course, no technique is going to be foolproof. Falling is an unfortunate circumstance, and basically these are just some strategies that help to reduce the impact and reduce the stress and the risks of any serious injury as much as possible. Now, before we jump into this, be sure to hit that subscribe button and turn on the notifications if you're interested in catching regular videos related to knee replacement surgery, recovery and rehab, exercises, and everything else. Now, a lot of these techniques are going to come from the Institute of Clinical Excellence, or the ICE company that does a lot of continuing education for physical therapists and rehab professionals. So I'm going to share a lot of the techniques and strategies that they have shared in some of their videos. So let's go ahead and share some of these important techniques and strategies to help reduce fall risk. So the first thing we want to talk about is limiting or avoiding straight lines. And what is meant by this is it's kind of a common reaction when you fall to fall with these outstretched hands down onto your hands and wrists, just like that. And that puts a lot of force through your forearm, through your wrist, and all the way up through your shoulder, and can increase your risk of having fractures in the arms and wrist and forearm, and other injuries throughout the arm. So instead, what we want to do, and the next tip is going to be to spread out the force, so spread out the impact through multiple body parts. I give the example of when you're doing an egg toss competition, and you're trying to toss the egg back and forth and catch it without breaking it. You don't catch the egg and just catch it straight like this, and don't move your hands and arms and just catch it like you would catch a normal ball. You catch it and then you kind of have this give to it. You kind of cradle it down toward your body. And what you're doing by that is trying to dissipate that force. It's kind of like a shock absorber, and decrease the force of impact of the egg coming into your hand. All of these techniques are the same thing. They're trying to dissipate the force and spread it out and decrease it as much as possible, which in turn is going to decrease the risk of any significant injuries when you fall. So again, let's go back to spreading out the force through multiple body parts. So when you're falling forward, for example, instead of going out on the outstretched hands, you're going to fall, you're going to use your forearms, and then you're actually going to come down onto your chest and the rest of your body. So it'll look something like this. So you see I use my forearms. I don't just stay there though. I kind of let them come down and dissipate that force finally throughout my whole chest and upper body. The next important thing we want to talk about is what parts of our body we want to hit the floor. So we want to take advantage of our body's innate padding. And what I mean by that is these big muscular areas, these big soft tissue areas of our body. So for example, in the front of us we have our pecs, or our chest muscles, we have our abdominals, and then of course in our legs we have our big butt muscles, our glutes, our big padding area, and of course our thighs as well. And then we want to avoid direct impact on areas where there's not a lot of padding, so those bony prominences. So the big one is kind of our sacrum, or the bottom part of our spine and vertebral column. Not, if you fall backwards, we don't want to fall and plop straight on our butt like this, leading for that increased risk of a compression fracture in your spine, or falling directly on the side of our hip where there's our femur, our greater trochanter it's called, and causing a femur fracture as well. So avoiding the bony prominence areas, taking advantage of the big muscular areas that kind of give us that natural padding. Other things we want to keep in mind is trying to bring ourselves down or lower our bodies down when we notice that we're about to fall. So for example, if I fall straight to the ground from standing up all the way, that's a pretty far way to come down to the ground. That's going to be a significant amount of force. If I notice I'm going to fall, starting to fall, and I start to squat down, bend my knees, already that takes me down 6 inches, a foot, and lowers how far my body has to come down till the rest of my body hits the ground and the floor. So squatting down, bringing ourselves down lower. And then the last thing I want to share before I do some demonstrations is protecting your head and your neck. So what I mean by this is our head and our neck are extremely important, of course, and we want to avoid any kind of direct impact to our head. We want to avoid any of that whiplash sensation or injury. So really kind of tucking our head and protecting it as we fall. So if you come and you're falling backwards, tucking that chin forward and trying to avoid that whiplash, that impact on your head or the back of your head. Same thing if you're falling sideways, kind of tucking your head and chin the opposite of the direction you're falling. So let's demonstrate a couple of falls from different directions. So falling forward, we'll go first. A couple of things to keep in mind. Again, we're going to come down. We're not going to go on outstretched hands. We're going to lower ourselves, squat down as soon as we start to notice we're falling. So it's not as far that we have to come down to the ground. Use those forearms to hit first. Well, actually it's going to be your knees and then the forearms, and then disperse and spread it out through the rest of your chest and your body. So something like this. Start to fall, we bend our knees and spread them out like this. So of course this is still kind of uncomfortable, but hopefully we're spreading out that force as much as we possibly can. With all of these, you can really practice them if you have a bed or a couch or something that's really cushioned or soft, maybe a really cushioned mat, that you can technically practice these things. If you don't have much experience with this, I would recommend having a physical therapist or someone with you to help you with techniques and strategies to just make sure you're safe. So let's talk about falling to the side now. Now falling to the side, again, we want to avoid that bony prominence of our hip. So we actually are going to try to kind of twist ourselves as we fall and try to get much of the impact as we can on our butt. And so, or you can also try a little harder I've found, but you can also try to fall onto that meaty part of the front of your hip and your thigh as well. I like to do it trying to twist and fall onto my butt. So again, you're going to bend the knees, use that forearm, and basically try to twist and hit on the meaty, padded part of your bottom, and then use the rest of your body to kind of come backwards as well and dissipate that force. So let's show that one more time. Start to fall. Twist to avoid that outside part of your hip and use that meaty, padded part of your butt. And then the last one, falling backward. Same thing, really important part for this is we don't, again, want to fall directly on our sacrum, directly on our spine. We want to dissipate that force. Also, we want to protect our head and our neck as we fall. So coming down. So again, it's almost like you're going to kind of roll backwards. Use your back, use your lats, your arms, your triceps, and dissipate that force throughout your whole body as you fall. I hope this gave you guys some useful tips and strategies. Again, if you do want to consider practicing some of this, just do it somewhere safe. You know, start somewhere up high, like falling into your bed or falling into the couch, the mattress of your bed, or make sure you have a professional, a physical therapist who has some experience kind of training people on how to do this safely. Thank you very much for watching. Again, be sure to hit that subscribe button so you can catch all of our latest videos related to knee replacement surgery. Be sure to leave your questions below and I'll be sure to get back to you. Thank you for watching.